So I think because we have quite a packed agenda for today, we'll get started, and I'm sure other people will join us as we move forward. So first of all, good morning, good afternoon, and good evening, and welcome to the first youth virtual seminar from the Co-Create project. We're really looking forward to this evening, to some really interesting discussions with our different panelists, as well as to hear from everyone's contribution later on and when we're having open discussions. So before we get started, I would just like to go through a few housekeeping items. So we will ask everyone to please stay muted at all times unless you're speaking. The seminar will be recorded and made available online later this week. If you have any questions, please use the Q&A function to post comments or questions. And then during the designated open dialogue sessions, everyone will have the opportunity to ask questions verbally. And for that, we will just ask you to raise your hand in the Zoom platform. And as I've just mentioned, the link to the recording and the slides will be circulated after the webinar. Next slide, please. So this is our agenda for today. As you can see, we have a lot to cover and a lot to get through, but which will all be very interactive and lively discussions, both with our panelists, but also with everyone who is here with us tonight. So Claudia, could I please ask you to go to the next slide? And we have a great selection of speakers tonight with us, and I will be introducing each of them individually as we go through the agenda. And so without further ado, I would like to introduce Professor Knut Inge Klepp, who is the project coordinator for the Co-Create project. He works at the Norwegian Institute of Public Health, where he is the executive director for mental and physical health. In his own research, Knut Inge has focused on adolescent health promotion, and he has worked closely with the World Health Organization and the International Society of Behavioral Nutrition and Physical Activity, where he has served as the president. So Knut Inge, over.
Thank you very much, Margot, and hi everyone. It's a great pleasure for me to be with you at this seminar and to be able to start it off with saying a few words about the project Confronting Obesity, Co-Creating Policy with Youth, or the Co-Create project as it is called. Next, please. So the Co-Create project is a 5-year research project that is funded by the European Union, and it consists of a number of partners, both youth organization, advocacy, public health organizations, and academic institutions. Next. And the main objective is to focus on policy change and see how policies actually affect the way young people are able to live their lives and how that affects their eating habits, their physical activity levels, and for that reason also their obesity levels. So the main objective is to focus on policy and see how policies can help young people make healthy choices. So we focus both on monitoring and benchmarking relevant policies, understanding what kind of policies are available and being implemented. But then most importantly, we collaborate with adolescents across Europe, and we're really interested in hearing the voice of young people and how you perceive the world around you and what policy options you think are important in order to halt the obesity epidemic. Next. So this is a busy slide, but it tells the story about Co-Create, how we use different sources of information in order to guide the policy options that we want to co-create. So one is looking at what is available policies today. So we have 2 databases. One is called the Nourishing, and it's listing and presenting the policies related to diet and nutrition that are available across countries or within countries as of today. And the other policy database is called the Moving, and that do a similar job on physical activity related policies. Then this is an area with a lot of research that has been going on for the last several decades. So it's important also within this project to learn from previous research, and we try to summarize and see what is the evidence as of today. And the third source of information is the perceptions and ideas that young people themselves hold when it comes to what are the drivers of healthy eating and physical activity. And for that reason, we try to do create what we call system maps, where we ask young people, what are the important factors? How have they changed? How are they interconnected? And we come up with these maps that really tell a story about how young people perceive their environment and what are the drivers. So these are three different sources of information that we then present and work with young people so they can explore it and within their own local community then see what are the important drivers and what do we think are the important policies that ought to be in place. And then within these youth alliances that are created, they also then test their ideas with other stakeholders in what we call dialogue forums, where they can meet policymakers, private sector actors and others to test out their ideas and refine them. And then at the end, we do a modeling exercise where we want to test the impact of these policies if they were to be implemented. So today you will hear quite a bit about how we then work with young people and also engage with other stakeholders. So I'm looking forward to the rest of the seminar. Thank you.
Thank you very much, Kunutenga. And I would like to now introduce Anna Rita from the Co-Create Youth Task Force, who will be introducing herself and presenting some of the work that has been going on in the alliances.
Hi, everyone. My name is Ana Rita. I'm 19 years old, and I'm from a small town in the north of Portugal called Viana do Castelo. I've been introduced to the Co-Create project by a friend of mine who I met in another project we were both part of. When this pandemic forced us to be at home to prevent the spread of the virus, I had the chance to take part in this project, and I'm very thankful for the chance I had to join Co-Create and to share my ideas with many people that have the same pleasure that I do, the same will that is to help other people and to develop some ideas to share and to implement. So we first started to have some brainstorming meetings in which we shared ideas with each other. Then we made some research and we developed our ideas to be presented to decision makers. Our ideas were including many things, but always with the goal to help people and to help them to have a healthy lifestyle and a better life. So I really appreciated to have the chance to take part in this project. It was very good for me. I've learned a lot of things. I had a chance to share my ideas, my opinions with many people, and well, in a quick way to say something about this project is that it's one of the best experience I've ever had in my life.
Great. Thank you so much, Anna. That was great. And we're very pleased to hear that you enjoyed your experience. So without further ado, I will now like to introduce Mariana De Almeida de Bellan. So Mariana has a background in political activism in the field of food and agriculture, working as a deputy leader in Inspire, a youth organization. Mariana also holds a bachelor degree in social anthropology from the University of East Anglia, a master's degree in comparative and international education from the University of Oslo, and is currently training to become a chef. So over to you, Mariana.
Thank you so much, Margot, and hello, everyone. It is a pleasure to be speaking here today. So I'm here on behalf of EAT, and our role in Co-Create is to create a tool, also known as the dialogue forums, to connect youth with stakeholders to refine youth-led policy ideas and promote action and commitments. In collaboration with the design firm Design It, we have developed a tool where young people ranging from 16 to 18 years old can fully express themselves on issues that feel important to them, and where adults can really listen to what they have to say. And the tool is therefore designed to be youth-led and youth-facilitated, and also to ensure a 50-50 youth to stakeholder ratio. It is also designed to facilitate youth moderation throughout the dialogue. Next slide, please. So the purpose of the forums is for the youth to get feedback on the relevance and feasibility of their policy idea, to connect with decision makers, to transition from idea to implementation, and to gain a better understanding of the policy issue from multiple perspectives. For Co-Create, this means to politicize the issue of obesity, empower youth, and position youth as agents of change, and develop new ways of holding an intergenerational dialogue. Next slide, please. Thank you. So the dialogue forums were initially in person using a physical tool. However, due to COVID-19, we had to develop a digital tool to facilitate dialogue despite the global pandemic. So the digital tool uses a combination of Zoom and Google Slides, where all participants are able to discuss and populate their ideas on this canvas that you can see here. And I know this is a very busy slide, but I will walk you through it. So at the end of the dialogue forum, you will have this populated canvas with all the ideas and inputs that the participants have shared throughout the dialogue forums. You will also see at the top at this canvas, the common vision inside of the cloud, which is a result of the discussions and interactions during the dialogue forum. Next slide, please. So far, there have been 9 digital dialogue forums carried out in 3 countries, being Poland, Portugal, and the Netherlands. And you can see the policy ideas that have been discussed on the slide. The youth participants are in majority female and from urban areas, but quite diverse in terms of political experience, socioeconomic background, and cultural ethnic background. And there's been a variety of stakeholders present in the different dialogue forums relevant to the specific policy idea discussed. We've seen policymakers, experts in relevant fields, teachers, and stakeholders from food businesses. And the youth to stakeholder ratio has also been well balanced, meaning that the youth have been well represented in all dialogue forums. Upcoming dialogue forums will be in Norway, the UK, and South Africa. And in total, we are looking at 11 more to come. And if you're interested or looking to host a dialogue forum, there are some key learnings that could be of value to bring forward that I want to share with you. Thank you. Some key learnings from the dialogue forum so far is the value of the unique perspectives that everyone brings to a dialogue. And in some cases, the stakeholders expressed that they learned a lot from talking with the youth and gained a better understanding of their unique and diverse perspectives. But what makes these conversations so fruitful is the rich diversity of the participants at the forums. Another thing that has come out from the dialogue forums is how the tool facilitates discussion without power imbalances, where all participants are able to build upon each other's perspectives to identify areas in which the policy idea could be strengthened. And the youth moderators and the youth participants have expressed the tool and the dialogues as very positive. We also see that when participants connect around a common vision at the end of the dialogue forums, it brings about a sense of collective ownership of the policy idea. And this again facilitates commitment to follow-up action on the policy idea. We have, however, seen limited follow-up of the dialogue forums, which tells us that there is a need to better integrate follow-up mechanisms into the dialogue forums. So we can move on to the next slide, please. So what's next? So the dialogue forums so far have been carried out at the local level. So next steps for EAT is to conduct scoping of national and regional dialogue forum opportunities. We're also working towards a global expansion of the forums, as well as developing an open access publication of the model. As EAT is leading the Work in Action Track 2 in the upcoming UN Food Systems Summit, we are also hoping to host a dialogue forum in the Food Systems Summit Dialogues for youth to share their perspectives and contribute to the summit. In this way, we are hoping to expand intergenerational conversations globally, but more importantly, put youth as agents of change on the international agenda. Thank you so much.
Thank you, Mariana. And I think before we move to the next section, we've just received a question for you. So about how do you recruit young people to participate in dialogue forums?
Yes, so I think there are other people's working in Co-Create that can answer that better, but we have work package 5 in Co-Create, which is the University of Amsterdam, who has this task where they create youth alliances in each country. They've been going to universities, youth organizations, and so forth. So there's been a variety of recruitment channels. But in the end, they form these youth alliances in the different co-create countries.
Thank you, Mariana. And so now I'd like to introduce Pedro Goncalves and Susanna Bouzinska from the Co-Create Youth Task Force, who have worked on the Co-Create Youth Declaration that was launched at the end of last year.
Thank you, Margot. So my name is Pedro Goncalves. I'm 18 years old, and I'm here to talk a little bit about the Co-Create Youth Declaration. It all started in the youth alliances that Ana Rita talked about, and it moved on into this great group that worked together to bring up 4 demands that are written in this declaration. So this slide, Susanna.
Hello everyone, my name is Susanna Bouzinska and I'm a 17-year-old high school student from Poland. I've been interested in biology since childhood, but took a deep interest in human health when I was diagnosed with type 1 diabetes. Joining the Co-Create group and taking part in the Co-Create Youth Declaration Task Force, I was primarily looking forward to meeting young people from different countries who are as interested in taking action as I was, and sharing my knowledge about healthy lifestyle and nutrition. Basically, the Co-Create Youth Declaration Task Force project consists in creating a document, a declaration containing demands and ideas, which hopefully can help with eliminating or minimizing the obesity problem among children and youth. As a group of adolescents from 5 different countries, we want to draw politicians and other stakeholders' attention to this problem, and we want to force them to do something about it, to make a change in close cooperation with us. Well, now me and Pedro are going to briefly present the fruits of our labor. So Pedro, please start.
Thank you, Susa. So the 2 first demands are these ones that you can read. We followed some evidence to write our declaration, and the first one, we know that the World Health Organization shows us how marketing influences children's food preferences. So, and because of the system, we see a lot more ads about unhealthy foods than ads about healthy food. And we are demanding companies to follow the World Health Organization guidelines about the criteria of the products that could and that could not be advertised. And how could they advertise their products without targeting children? We're also demanding a change in this system and bring a better and healthier future to today's children, tomorrow's adults. In the second demand, we are asking 2 things. We are asking to change a little bit the educational system, and we want to include nutrition and cooking classes since a young age. And this would be children would become more independent and they would know how to cook instead of buying unhealthy products from the cafeteria, from fast food restaurants, etc. On the other hand, we're also asking to get these children and adolescents proper meals at school, because children spend a lot of time at school. So we need to be consistent and give them healthy food, give us healthy food at school. So these 2 sides of the second demand would work together to make school a healthier place. Next slide, please.
Okay, so the third demand in our declaration is implement sugar-sweetened beverage taxes to make unhealthy foods more expensive. We believe that if this demand is being introduced, it will encourage both younger and older people to buy sweetened drinks seldom, if ever. And we hope that it will therefore help to reduce the obesity problem among them little by little. And the last demand reads as follows: offer all children and adolescents free organized physical activities at least once a week. We think that forcing kids and teenagers to eat healthy meals is not enough to completely eradicate the obesity problem among them. According to scientists from all over the world, young people should practice for at least 1 hour per day. Therefore, it really should be emphasized that physical activity is as important as good nutrition, and that's why we decided to write a demand concerning this topic. Next slide, please.
And after writing all of these demands, we adopted the declaration at November 17th. And I would like to underline a sentence that is written in the ending part of the declaration that says, "We all know this disease has serious implications for public health, especially for the future. Yet no country in the world is on track to meet the World Health Organization's targets of no increase in obesity prevalence by 2025. So we really need to change this system to bring a brighter and healthier future to everyone." Just to finalize, as I said, we adopted the declaration, and we have been participating in some events like this, and we are in a phase to promote the declaration and to show the work we've been doing. And we've participated in events such as Children Eating Well in Cities, organized by EAT, UNICEF, and Cities Changing Diabetes. We've participated in the EATS broadcast and in the City University of London Symposium. So if you'd like to get to know a little bit more of the work we've been doing and the work Co-Create has been doing, you can check out the social media accounts that are in the screen. Thank you.
Thank you very much, Pedro and Susanna. This was a very
sorry,
good
Margot. I meant next slide. I'm sorry.
Thank you very much. Thank you very much for providing a great overview of the work that was put in the declaration. And I know Margaret just posted the link to the full declaration for anyone who would be interested in reading it. And I see that we have a question, but we're just about to move into the question session of our meeting, which will be moderated by Tasha. So I will briefly introduce Tasha and then let her take over. So Tasha Makaya Cora, sorry if I'm mispronouncing it, is the co-chair on the Youth Back 2030, an organization that is working to redesign the food system to put at the forefront of its operations. As a passionate activist, Tasha is campaigning to break down barriers to and disparities in the accessibility and availability of healthy food for all young people. She believes every child should have the opportunity to thrive and be healthy no matter where they live. So Tasha, I will now leave it over to you.
Fantastic. Thank you so much, Margot, for that introduction. I am so excited to be part of this conversation. So one of the reasons that I joined Bite Back was basically I was sick and tired of adults having conversations about young people and the youth, and not a single young person was involved in that discussion. And so for me, getting involved in things like this, where genuinely the voices of young people are heard, it's always really exciting and also really motivating as an activist. A lot of the time you don't see the change that you want to see fast enough, and it can be quite demotivating. But when I meet other young people who are on the same journey as me, with the same goal as me, it's always very inspiring. So we'll start off with some of the questions that have come up in the chat function. And so the first question for me is, within the current, comes to anybody of our youth ambassadors here, wouldn't the current physical education system in the majority of European countries already fill this demand? I think this comes off the back of how, you know, in school you already have your regular PE lessons. For you guys, do you think, why is it important that, you know, free physical exercise should be made more accessible to younger people? And that could be for Pedro, Susannah, or Anna to answer. I mean, for me, what really stood out for demand number 4 is the fact that it's free. I know when I was going to school, I only had my PE lessons every other week. And I know that's not as, you know, as often as it should be, or as it's recommended by many health organizations. So what I really liked about demand number 4 was that it's the fact that it's free, which allows for children and other young people who come from disadvantaged backgrounds and communities who perhaps don't have the same access to resources that allows them, you know, to explore their outdoors and enjoy the environment the same way that some children can. The fact that it's free makes it even more accessible. So that really does stand out to me amongst some of the demands that you guys are calling for. And I guess there's a question for Pedro. What advice would you give to young people who want to engage with businesses and companies and governments? What advice would you give to them when they are trying to reach out to these people?
I don't know, maybe pay attention to the events and the opportunities that we are given. Sometimes we don't quite see what this email is about and we make a blind eye. So for me, it kind of came out of nowhere, not literally, but I just grabbed the opportunity and it started to move on into this great opportunity. So my advice would be pay attention to this little thing, these little opportunities that can move on into something greater and give you the opportunity to speak up.
That is fantastic. Yeah. And I think a lot of the time, these kind of opportunities aren't really accessible to young people. At least a lot of the time we don't know that it's happening. So sometimes I guess it's about taking initiative and kind of going out for yourself and finding these opportunities. Thank you so much for your response, Pedro. Susannah, would you like to add on to what Pedro has said?
Actually, I don't have anything to add. I can answer your previous question. Research of World Health Organization shows that about 80% of adolescents in school age have never met recommendation of at least 1 hour of activity per day. So that's why we think we should add such a demand to our declaration.
Fantastic. Thank you so much. Definitely agree with everything that you've said there. And this is another question to any of these to answer as well. How do you ensure that you include the voices of all young people in the community, especially those younger people who are perhaps in areas that it's harder to reach? How do you engage them? And this is open to any of you guys to answer.
The way we worked with everyone was by having online meetings. We couldn't gather up everyone from every youth alliance, but the co-create team chose some and asked for some volunteers that would like to be more engaged. And during the meetings, we brought the principal topics that we talked about in the youth alliances. So at least from my perspective, I think I brought the issues that my alliance talked about during the alliance meetings. I don't know if anybody else has something to add to this.
Yes, we actually are still communicating with our alliances in our countries, and I myself talk to my closest friends too to know what they think about our declaration.
Definitely. I definitely agree with what you're saying in terms of asking your peers as well about their input. And alongside what Pedro said in terms of using social media to really reach out to all types of young people. For me, it's also about really going into the communities as well, really engaging with them on a personal level. Because I know, sometimes not everybody has access to online or to social media, obviously outside of the COVID context as well, but really just going into schools and communities and youth clubs, engaging with them that way and really getting their opinion on what are they expecting, and kind of like getting their input and advice on how they experience the food system. Because a lot of the time, the way an adult experiences or engages or interacts with the food system is certainly not the same that I interact with it as well. So I really like that question. Another question as well, again, open to all of the youth panelists here, is what does meaningful engagement mean to you guys? I know for me personally, working with organizations, it can be quite difficult to decipher if an organization really cares about the voices of young people, how authentic they are. But also you have other companies who do it as almost like a tick box exercise. So they kind of just involve young people for the sake of involving young people. So we'll go to Anna first. What does meaningful engagement mean to you or look like?
It's like it's not like keeping, it's like starting to have a bond with other people, and that bond will be forever because we live together. We are from different families, we know different people, but somehow we manage to know each other and to work together. And for me, engagement is to share what you are with who you like and what you want to do to make people's lives better. That's one of our purposes here in the Youth Alliances, in the team that managed to create this declaration. And for me, that's the meaning of engagement. Of course, it's different from people to people, but for me, it's engagement. It's all about people and sharing what we are and what we want to do.
Definitely. Before we go on to the other panelists and get their responses as well, I definitely agree with you in terms it's about building real, authentic, genuine relationships with people. And that's often what we're not able to see especially when things are online as well. But meaningful engagement really does look like, these stakeholders reaching out, really wanting to know what I think and how I view the world and how I experience the food systems as well. So thank you so much for that response. Pedro, what does meaningful engagement look like to you?
For me, let me start by saying the name of the project is Co-Create. So right away, we are co-creating with adults and policymakers, with people who can make things happen with us. And when working at the Youth Alliances and with the task force team, I felt heard. I felt like I could give my opinion and share the opinions my alliance have. So I really felt like this project and the task force was a meaningful engagement. So for me, it's actually this, working together to have the same results in a healthy way, with all the parts agreeing in that result.
Definitely. I think the feeling of having feeling like your voice is genuinely heard and that you bring value to the conversation is definitely important. Because I think a lot of the time the stereotype with like young people, when we are voicing our opinions and experiences, it's often, oh, it's just noise in the background. Oh, they don't know what they're talking about. But to definitely feel as if, what you're saying is of great importance and that, they genuinely care about you is definitely important. And Susannah, to you, what does meaningful engagement mean to you?
To me, engagement means talking to as many people as possible. And I think that during the Co-Create Youth Declaration Task Force project, we had an opportunity to do so.
Fantastic. Exactly. It's about spreading the word as much as possible, right? Exactly. I totally agree with you guys. So I guess we'll wrap up this section of the Q&A. It was an absolute pleasure to speak to some of the Co-Create youth, and I'll hand on over to Margot for the second section.
Thank you very much, Tasha, and thank you very much for these really inspiring discussions. So we're going to be moving into the second part of our meeting, where we will be hearing from a number of speakers on how youth catalyzing actions across the globe. So first, I would like to introduce Andre Martin Vushkovic. So Andre is a recently graduated medical doctor from Ljubljana. He spent most of his student years working in youth organizations such as the Slovenian Medical Students International Committee and the International Federation of Medical Students Associations, where he served as a volunteer and later in executive board positions. His first employment after graduation was in Youth Network No Exclude Slovenia, where he worked as a public health associate. His work has included designing prevention programs for youth, advocating for better health policies in the field of addictions, and training youth activists who want to make the world a better place. So over to you, Andre.
Thank you, Margot, for that quite a lengthy introduction. Today, I would like to share more of a personal story, maybe to spark a discussion as well, and stray a little bit off from the statistics and other facts maybe. And it's an anecdote that really changed the way I view advocacy and the role also of young people in advocating both on an international and also a national level, even more so. And the story starts in 2014 at the regional committee of the WHO Euro, where I was a delegate of the International Federation of Medical Student Associations. And it was my first meeting like that. So I was really proud of my delegation. It was being super active, talking to different member state representatives, delivering an intervention at the plenary. And at the time I thought, this is it. This is advocacy at its highest level. Super proud. So then later on in the coffee break, I was approached by a representative from Slovenia who I knew from back home. And she came up to me and she told me, Andre, your guy who did the speech, yeah, he messed up, And I couldn't believe what I was hearing. I was really shocked. What do you mean? And she must have caught on to that because she said, no, like, don't get me wrong. Everything that he said, it was true, but he sounded just like any other person in the room. He was reading from a piece of paper, telling us numbers that we all know, and reading it out like we do anyway. He tried to be like everyone else in that room, and we already have everyone else. We don't have anyone who will shout at us saying that we're not doing our jobs well enough and that people are dying while we're in our offices and that we need to do better. Like Pedro was saying earlier, at the end of his intervention, he was saying, we're not meeting the targets. Wake up, people. That's what we need. And she told me, if you're not the one saying that, we don't have anyone else who will do that for us. And that stayed with me for quite a long time. And at first I didn't want to believe that he didn't do a good job. But when I came back home and we had a similar case in Slovenia where we were changing tobacco legislation at the time, it clicked. Everyone was defending their own case, looking out for political reasons or different interests of the government, of the economy, blah, 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 looking for excuses. And in the end, there was only a handful of people, mostly young people from NGOs saying, hang on, these are our core values that we're talking about. This is how we as a nation want to be represented and taken care of. And it's only then that I truly understood that what we were doing at that moment, that was leadership at its finest, because everyone was just trying to manage the situation as best they could, but nobody was really leading with values. Nobody was putting the community or the health of the community in the forefront. Now, don't get me wrong, I'm not saying that you shouldn't or we shouldn't look for solutions or go to statistics for clarification or justification. And it's great that you're doing that. And it shows that you have skill and that you're mature and that you understand that things don't just happen because you wish them to do so. But I think also that shouldn't be traded for the passion and standing up for your values, because management and solutions will follow leadership and not the other way around. And it's there where I think really the place of young people in civil society in general is when advocating for change, because there aren't that many people who will do it if you don't. So that's from me for the beginning. I'm sure that other speakers will also have nice presentations and tell you more about how you can do it. And thank you for listening.
Thank you, Andre. Thank you very much for sharing this story with us. I think it's giving us all some reflections. So I will now like to introduce Marie Herslev. So Marie is a Danish physician and the chair of NCD Child. She's also the chair of the WHO GCM NCD Lab on Youth and the Next Generation and the commissioner on the Lancet Commission on Gender-Based Violence and Maltreatment of Young People. Alongside her global advocacy and research work, Marie is currently in her formal training in pediatrics at Herlev Hospital in Copenhagen. So Marie, over to you.
Thank you so much, Margot. And I've also been on the executive board with Andre, who just spoke, which is a dear friend of mine, and I very much agree with his sentiment. We used to go to the World Health Assembly in pencil skirts and blazers, and thinking that we should look like everyone else. But actually, we might not have to. We have to get in the door, but we need to speak as youth. Well, as long as we remain youth, but we need to be different, and we need to bring that fresh perspective. I really think that's one of the key things that we can do. But I guess this section is called how is youth catalyzing change on childhood obesity? And I wanted to, because NCD Child is a global coalition, I wanted to just highlight a couple of things that we've been doing and that young people are doing all over the world, because there are so many incredible young people that are creating change and doing things on the ground. And well, for NCD Child, we've had the chance over the last year to look into sort of a deep dive of the evidence on how COVID affected children's health, and particularly in regards to childhood obesity. And really our findings, as many of you will know, that there is We've seen an increase in sleep, we've seen an increase in screen time, we've seen less physical activity, and often also children are eating less healthy and nutritious foods over this time with school closures and COVID in general. And of course that poses a risk in general to increase childhood obesity, with the further risks of NCDs and premature mortality from that. And then also children that live with or do live with obesity have a greater risk of more severe COVID infections. So that's something that we've been quite concerned with. But then all of the other young people, I wanted to give you a couple of examples. So for example, we have a young man on our executive committee who is from Tanzania, and he's just done a study that was published focusing on childhood obesity in a specific region of Tanzania. There is one of our young leaders from the UK that has been leading research projects around policies and focusing on the marketing strategies of the unhealthy commodity industries and how that affects child and adolescent health. We have actually a young female researcher from Trinidad who is on this call as well, Stephanie Whiteman, who is a person that we work with as well. She does research focusing on childhood obesity in the Caribbean, where they are facing very high burdens of NCDs and unique challenges from being small developing island states. We also work closely with a young woman from Mexico who's a nutritionist by training, and she's through CSO been doing advocacy and played a key role in ensuring proper front of package labeling in her country, which makes healthier choices easier. And then we have been focusing more on school health in NCD Child recently, and had a workshop in Latin America and focusing on that region. And really, we're seeing how many NGOs and young people are mobilizing behind creating more healthy food environments in the schools and in the school context for children. So there are incredible activists and young people all over the world that are working on these matters. And what do we? I guess the question is, how do we engage and how do we make the most of all of these young people? And I think we need to do kind of what you're doing, actually, because co-creation and working across generations is really what I believe in, having done sort of youth global health advocacy for the past, I guess, 8 years or so. And we need to bring, well, first of all, we need to bring young people to the table, and we need to hear their voices. We need to listen. And that's the biggest step, and that's the hardest one for us to get to. But we also need to create safe spaces for young people where they can grow and be offered training and the opportunities to to discuss with each other and learn from each other. And then that co-creation, I think, can be between or across generations, can be even more powerful. And we need to make sure that we bring these amazing young people to the decision makers at the top, for those decision makers to realize what the young people are capable of and what we can achieve together. And I would say I'd like to end on a positive note, because in general, I think there are a lot of good trends out there in the global landscape. The WHO is developing a youth council at the moment, and Dr. Tedros, the Director General of WHO, when he launched it, he said, we don't want it to be a youth advisory council, take out advisory, we want it to be more than an advisory council. So we're still to see what that exactly looks like, but well, maybe we can discuss that next time we have a meeting like this and see if it will really be a council that will be part of creating change and some of the dynamics inside the WHO and in global health in general. And then there are more youth commissioner seats on Lancet commissions. We're seeing young leaders programs from many different major organizations. And yeah, we need to continue to push for that progress, but we also need to ensure that it's meaningful and that it's not tokenistic. And that is an important point that I'd like to discuss more. And then after that, we also need to make sure that it also happens at the local and the national level. It is not a global exercise only. A lot of the decisions are made at the national level, and we need to keep that in mind as well. Thank you.
Thank you very much, Marie. Thank you for sharing these great examples and also some key mechanisms and things that we always have to keep in the back of our mind when trying to engage youth in our work. So I will now like to introduce Danielle Walwin. So she works for the Healthy Caribbean Coalition as an advocacy officer, and she focuses on implementing HCC's Regional Childhood Obesity Prevention Project. She also coordinates the Healthy Caribbean Coalition's youth arm, the Healthy Caribbean Youth. Danielle is a certified fitness instructor, passionate about making physical activity more fun and accessible to all. So Danielle, over to you.
Thanks so much, Margot. And I have to say, before I even start, huge congratulations to the Co-Create team. I have been smiling this entire time because I'm honestly feeling super, super inspired. So thanks so much for having us, and thanks so much for creating a space for the Caribbean to share their perspective. Next slide, please. So for those of you who may not be familiar, the Healthy Caribbean Coalition is a network of civil society organizations focused on the prevention, management, and awareness of NCDs. And one of the things that we focus on is childhood obesity prevention. And I wanted to highlight this slide, or first show this slide, just because these are our major priority policies. And as you can see, they're very, very aligned with the Youth Declaration. So even though we are oceans apart, I think we really do have a common goal. The next slide, please. And so youth have been at the forefront of a lot of HCC's childhood obesity prevention and NCD initiatives. So in 2014, we had Youth for NCDs, which was an initiative really focused on persons living with NCDs, persons affected by NCDs, and passionate. And in between 2014 and now, we've had ongoing youth consultations, and these consultations have been used to inform ongoing guidance documents and childhood obesity prevention initiatives. And then in 2019, we were very pleased to have Mr. Pierre Cook on board. So he's our very first Youth Voices Technical Advisor. And Pierre is 21. He is a second-year law student at the University of West Indies here in Barbados. And he has made it his mandate to promote childhood obesity prevention, healthy school environments on local, regional, and international stages. A lot of his key messages surround a rights-based approach, strong, effective policies, and then of course, I'm loving the conversation about meaningful youth engagement because that's one of the things that he focuses on. So we're very, very proud of Pierre, and he's very involved with World Obesity Federation and has also done a lot of work with the NCD Child. And in 2020, we were very pleased to have launched Healthy Caribbean Youth. So it's the Youth and Young Professional NCD Network. Next slide, please. And the one thing that's pretty unique about this network is that we have young professionals from across the region with varied backgrounds, all focused on NCD prevention, management, awareness. The really cool thing that I enjoy is that, again, they have various backgrounds. We have mental health professionals, physiotherapists, nutritionists, fitness instructors, educators, again, all coming together. So although we are spread, as you can see, all over the Caribbean, we come together for that same goal. And I'm feeling a very, very similar sentiment here. Although we're across the world, we're really coming together to shape healthier environments. Thanks, Margot.
Thank you very much, Danielle. And I would like to introduce our last speaker in this panel. So Katrine Engelhardt. So Katrine works in the Department of Nutrition and Food Safety at WHO headquarters since 2018 on policy actions and good governance to create healthy food environments. Before joining WHO headquarters, she spent most of her life in Asia working on urban health and food systems and was Regional Nutrition Advisor at the WHO Regional Office for the Western Pacific region from 2013 to 2017. Over to you, Katrine.
Okay, thank you. Thank you very much. It's a great pleasure for me to be on this panel. Thank you for having me here. I hope you can all hear me. So I'm glad that this youth seminar is focused on child and adolescent obesity. And as we've heard, it's indeed one of the most serious public health challenges of the 21st century. And Pedro was spot on to say that we are unfortunately off track to reach the World Health Assembly targets. And from what previous speakers said, I think it's time we try to merge these two pictures on the slide and not just have these rigid health assemblies, but also fill them with a bit more life. I will touch on the Youth Council, which was mentioned earlier just a bit, but I wanted to focus just on one of the actions that I think are extremely important and where we need the voice of youth and the voice of really young, dynamic, passionate people, because an urgent action is actually to overcome commercial pressures. We know that profit motives of the commercial sector pose many threats to child health and well-being. We know that companies profit from aggressive marketing to which children are exposed. And the problem is that this marketing shapes food preferences, your food preferences. It influences what you consume. I think none of us on the call can say that our food preferences were shaped just by what our parents gave us. We're influenced by the marketing arena. So influenced by marketing, we associate sugary drinks with happiness. We think energy drinks can help us fly. Unhealthy snacks are considered treats. And I think as a whole, it will be important to change these perceptions and to work together to create enabling food environments which are conducive to healthy eating. And importantly, in these food environments, we need healthy norms. We need to make health and healthy choices the norms. And I think we can. So on this slide, I've just listed 4 areas of focus of WHO, which do align very nicely with the actions that you have identified in the Youth Declaration. And those include the regulation of marketing. And I must add, Knut Inge, who introduced the session, he was chair of the WHO European Network on Marketing since 2008, I think it started. And maybe one of the reasons we haven't been that successful in regulating marketing is because youth haven't been involved as much. So I encourage everyone on the call to step up your voice and move it to the foreground, not keep it as noise in the background, as Tasha said, to help really advocate for marketing restrictions. But also taxing sugar-sweetened beverages is a key action, ensuring access to healthy food through healthy public food procurement, and ensuring school food environments provide a healthy and enabling environment. We've heard a couple of opportunities already, how youth can engage. There is also the opportunity to engage in the UN Food Systems Summit, for example, through the UN Youth Focus Groups. I think they were mentioned before as well. And WHO has established a Youth Council. And the Youth Council, I think the terms of references will be announced this week or within the coming weeks, very soon. And actually one of the functions is to propose and design and incubate new initiatives, new ideas. But I also think that it's important not to forget old recommendations. And marketing, as I said, isn't an innovation, but it's something we need to address jointly. So I know we're running out of time. I'll leave it at this. Thank you.
Thank you very much, Katrine. That was a very useful presentation and nice to see how it aligns with the Youth Declaration. So being very conscious of time, I will quickly pass it over again to Tasha to lead a very, very brief discussion.
Fantastic. Thank you so much to all our panelists who have joined us this evening. I've only got one question for all of you guys to answer, and that's really, what is the biggest challenge that you guys face when it comes to engaging with the young people, with the youth? Because I know at least, it can be a very tough crowd to get involved. So for you guys personally, what is the biggest challenge that you have faced when it comes to engaging millennials, Generation Z? Let's go over to Danielle first.
Thanks so much for the question, Tasha. I think, again, it's, at least for us in the NCD childhood obesity space, it's making, I think, making the connections, because we promote non-communicable diseases, and I think a lot of us still think that it's something that's happening in the future. It's something that's for older adults. So for us, I think a challenge is for us to reorient it and help people understand that this is something that can engage youth, can affect youth. And specifically that childhood obesity is again, something that is a prominent issue in our society. So I guess it's just raising the awareness of the issue and helping youth understand the influence that they can have in advocating for the issue. So just putting the two together.
Definitely, and I agree with you. It's about changing the narrative, right? So when we talk about obesity, it's not just, an individual's part in, their health, but also the role that our general environment has played in all of this as well. Fantastic, thank you so much. Marie, what is the biggest challenge that you have faced with engaging young people?
It's a very interesting question, Natasha, because I was just gonna flip the question around and say what is the biggest challenge in engaging the non-youth, and then I can list a long list of things, but maybe it is an interesting exercise. I grew up in IFMSA, the International Federation of Medical Students Association, and we've always had a very big cohort of people. So I think it's been different also because medical students do understand sort of how the life course approach. That's really what you're taught in med school. But I do agree that I think there is a lack of interest in this area in general in the young population, especially in adolescence. And I think there is a great focus on what's hip or what's in, and that might be healthy habits, but it might also sometimes be unhealthy and quite frequently unhealthy habits. So and linking those to mortality 50 years later is a pretty difficult thing to do. So we might need to think in other ways and change our perspective on how we go around these. And I mean, there's been a lot of talk in some of the networks that I'm part of around using social media like Instagram, TikTok. How do we reach broadly youth? In Twitter is not the place to be for that in many ways, at least they think, and LinkedIn certainly not. So how do we get out there and have some compelling messages where we engage people? I'm not sure, but the conversation is very interesting, and maybe we have to make the messages a little bit simpler than we are at the moment.
Definitely. I think whenever we have conversations about health, a lot of jargon is used that a lot of young people have no idea what it means. So sometimes it could be just simply simplifying the conversation so that everyone has the opportunity to engage as well. Thank you so much, Marie. Let's hear from Andre. What is the biggest challenge that you face with engaging young people?
Thank you very much. I had the same thought as Marie, thinking, no, isn't it the way around? Aren't we young? But I suppose we're getting a little bit older. So yeah, definitely. I would tie on to what Marie was saying at the end, is that I just think we're not that good at reaching the spaces where young people are right now. I think we might try to model a little bit too much on our behavior when we were younger as to how we would have been reached, but we're neglecting the fact that technology has moved forward, that young people just spend their time in different ways, they have different needs. And I think we could do a little bit better addressing those environments right now. And that's something that the industries are doing really, really well. So maybe something that we can also learn from them into, how to reach into a person's pocket. Of course, there's a lot more from our perspective that needs to be thought of, thinking about ethics, thinking about, meaningful youth engagement is also about consent. It's also about giving the invitation, but then giving the choice of saying no as well. And that's something that maybe the industries aren't really going so far with. So yeah, it definitely is a challenge, but I think there are some learning points there.
Absolutely. I like your point on how perhaps there is something for us to learn from the industry. We know that, the industry is able to use some of the tools that young people are always on. So social media, I recently read that about 15 billion adverts are watched by young people every single year. So perhaps we need to engage with that same platform as well to inform young people about health and nutrition as well. And then finally, let's hear from Katrine. What is the biggest challenge that you're facing with engaging young people?
Thank you. I must say I'm also a bit confused by the question. I mean, I think one of the challenges is that as adults, we tend not to listen to kids. And when we think that we're ready to listen, then they won't engage with us anymore. That's what I'm noticing with my two children, but they're a bit younger, but still becoming very vocal. But I think that the listening part, so that's from the other end. I mean, you're doing an excellent job. You're passionate. You want to engage. You want to tell us your concerns. But we who are on the responding end don't listen sufficiently. So that's turning around the issue. And I think it was interesting to hear about the learning from industry side. And the 15 billion ads, that's actually what we want to stop because we want to restrict marketing. So I always, I'm always cautious about learning from industry and also using terms like social marketing, because it does always play back into the sugary drinks, the happiness side, and unhealthy snacks are great. We need to really disengage, disentangle from that. And I think it's important really for actually the youth to engage with youth. I mean, you are still youth. The people who've spoken are still youth. And maybe me with almost 50 don't know how to engage properly with youth anymore, but you're the ones who know how to make these messages. So that's why you established this youth declaration. And with this youth declaration and other great initiatives, you can really increase the voices that you have and don't give up on that, and make sure that the adults, or not adults, the older people listen. I could probably say much more, but then, I know we'll be over time, so I'll stop here.
Yeah, and I guess this is why this is such a great platform, because it's not only about, hearing from young people as well, but in this way, we're able to tell you guys what we want to see, what does meaningful engagement mean to us, and how we can make change. So I'll wrap up this Q&A. It was fantastic to hear from each and every one of our speakers today. And thank you so much to Co-Create for inviting me on this evening.
Thank you very much, Tasha. And being very conscious of time, I will very quickly pass the last and final words to Margareta and Claudia.
Hi, everyone. Thank you. I'll be brief, but it's been really great connecting with all of you guys tonight. And I think it's become really clear that young people have the power to create change. As young people, we're often told that we're the future. And yes, that's true. We are the ones who will have to live the longest with the consequences of the policies that are led today. But we're not only the future, we're also the present. And I think that our panelists have illustrated that brilliantly today. So I hope you want to continue your engagement with promoting healthy lifestyles for everyone. And if you're interested in following what's going on in the Co-Create project, I would like to invite you to follow us on Twitter We're not yet on TikTok, but maybe that's the next steps. You can find us at EU_co-create and find information on how you can subscribe to our newsletter, where we'll share more information about what's going on in the project. And we'll also be sharing more information on how you can access the Co-Create dialogue forum, which is expected to become open access for all in late 2021 or early 2022. And I would also encourage you to check out the website of the youth health organizations to find more tools and information on how you can get engaged. So that's yho.network. And with that, I would like to pass the word on to Claudia. Thank you, everyone.
Hi, everyone. Just a few words from me, but thank you again for joining this evening. It's been really inspirational to hear from so many youth voices, and I just wanted to share a few of the platforms that we use at Co-Create that you can engage with to learn more. So we have Healthy Voices, which is our educational and capacity building platform, and it really offers a space for you to submit blogs should you wish, and to get actively involved in discussions, as well as an opportunity to actually access a toolkit, a suite of resources. So we have advocacy toolkits that we like to share and upload on there. And on that note, we're very excited to be working with our colleagues in the Caribbean. So Danielle on the call, for instance, on a how-to advocacy e-manual. So this is for those who are interested in health advocacy. So we're very keen to work with you on this initiative, and should you wish to learn more, we'd be very happy to share further details. So I will follow up with an email to everyone that has joined this meeting. But lastly, do follow our Co-Create Twitter, and regularly check our website for updates. And the World Obesity Federation will be soon launching a youth-led podcast, which is on childhood obesity. So we've had Tasha involved in this initiative, and a lot of other people on the line who are sharing their insights in the space, and really dispelling some of the myths, and sharing personal stories as well that I think are very, very inspiring. So that was it from me, but thank you once again, everyone, for joining, and have a lovely remaining day.